Schizophrenia is a medical illness that affects a person's mind. The basic abnormality of this illness is a loss of touch with reality. What I mean by that is that the individuals in an acute episode of schizophrenia are unable to distinguish between what is real and what is not. As a consequence of that, they experience a lot of symptoms such as hearing of voices or seeing things that people around them are not able to hear or see. They start developing suspiciousness towards people around them, that somebody is around trying to harm them or plot them, or people around them are talking about them particularly. Because of these symptoms, they will often be seen smiling or talking to themselves, or becoming scared or fearful and angry without any reason. They also suffer from something called as negative symptoms, which leads to a very much severe inability in engaging in day-to-day meaningful activities such as hygiene, taking care of themselves, bathing, grooming, maintaining social relationships, not speaking much. They also suffer from cognitive symptoms such as having a difficulty in planning tasks, focusing on tasks, difficulty in remembering things. A major difficulty in managing this illness stems from the fact that individuals who suffer from schizophrenia, since they are unable to differentiate between what is real and what is not, many a times do not believe that they have a mental illness or that they even require treatment in the first place. They might even flatly refuse treatment in a lot of cases. Speaking about the prevalence of this illness, probably around 3 to 6 in 1,000 individuals develop this illness, typically in the age of late teenage or early adulthood. While the exact cause of this illness is not known, multiple factors such as alterations in levels of chemicals in the brain called the neurotransmitters, abnormalities in genetic makeup, subtle injuries in the brain at the time of delivery or pregnancy, when they are in their mother's womb. Stress is a major factor that can precipitate the illness. Stress of any kind, be it financial, relationships, social circumstances. Certain drugs of abuse such as amphetamine and cannabis can also trigger the illness in those who are at risk of developing it. When it comes to treatment of the illness, it is always via a combination of medications and psychological and social interventions. The medications typically help by minimizing a lot of symptoms that we just discussed above, especially the positive, the extra symptoms where they start hearing things or being suspicious about things around them. Medications do not help a lot with the negative symptoms. But importantly, along with the medications, a lot of psychological and social interventions are required. Just as a person who has diabetes will require, lifetime focus on diet, healthy lifestyle modifications and regular exercise so that its medications work effectively. Similarly, even in schizophrenia, a lot of other approaches such as counseling and training are required to help the individuals manage their memory problems, lack of motivation, poor hygiene, as well as managing stable jobs and relationships. But this is where the combined efforts and care and support of the family members, the psychiatrists, the psychologists, and social workers becomes important in ensuring a patient's successful recovery. Thank you.